Have you all heard about something called PEA? And it's not to be confused with P or P's that sometimes I know when you try to spell it in Google or research. So let's teach you today about something called P.
Yeah, so it stands for palmitoyl ethanolamide. Now, that's a big mouthful. That's why we usually refer to it as PEA, but it's a really fascinating compound. People have been looking at it for a little bit for now for chronic pain.
So exactly what is it? Is it a medication? Is it a supplement? Is it a food additive?
Yeah, so it's interesting. You can buy it as a supplement, but it's actually a molecule that your body already makes, and it works on this thing called the endocannabinoid system. And most people have heard of the endocannabinoid system when it comes to the cannabis plants, right? Like cannabinoid and THC, those things all work on the endocannabinoid system, but probably so do things like Tylenol. So this endocannabinoid system, it's this really important conductor, and it sort of balances the body's pain systems.
Yeah, just really think of your body. A lot of it is like levers and pulleys, as I explain to patients, right? Like
Yeah.
inflammation for short bursts, it's okay. But when inflammation doesn't stop or it gets stuck in a certain state, we have to teach it how to go back to its balance. So a lot of times it's not blocking about the pain and it's not like hammering something back into submission. It's really helping your system go back to the treble and bass. Let's get it back in tune. Let's modulate the system and help it go to its normal balance of normal inflammatory, normal cytokine production, but not this inferno that keeps instigating and obviously chronifying and making your pain worse.
We talk about it a lot like the conductor of an orchestra. Like all the people are already there. They've already showed up to the orchestra, but without a conductor, things aren't balanced. They don't sound right. And the same is true with our inflammatory system and our pain system. The thing PEA seems to really be helpful for is that microglia. We've talked about that before. These supporting cells, these networks tell our nerves what to do, how to behave. But when these networks, these microglia, they get overactive, the pain signals can really, really be amplified. And PEA just kind of helps that go back more to a normal level and helps quiet that system back down.
Yes. So just remember, when things go out of whack, you need a conductor to bring
Yeah.
everything back in balance, whether it's life, whether it's in your kitchen, whether it's at work, right? So these are just like tools and helpers that we call them, and just kind of trying to educate you on additional tools that you can learn about, discuss with your clinician, and see if that might be a right fit for you. So, Matt, if they're interested in this, is it a medication that they can prescribe? Is it a supplement? What is the best way to go about learning and utilizing this if appropriate?
It's a supplement, so it's readily available, but really you should be talking to your clinician to see if this makes sense for you, if it fits with the rest of your treatment. But we do break down these tools, things like PEA, things like low dose naltrexone, and then other kind of system-based approaches in our book, Mastering Chronic Pain. So check it out.